Welcome to All Health Talks with Dr. Lindelani. So today is going to be an amazing episode. It's actually our first episode, right, Doc?
Yes, it is.
It is our first episode. I am not the star of the show. I am taking the role of an usher. And we are starting this beautiful venture together. But the doctor is going to carry it through her shoulders. So we're going to be having different guests talking about everything health. As you heard the name, it's All Health Talks. And Dr. Rinderani is the founder and the visionary of AllHealth SA, which is a medical practice in Atteridgeville. And then she deals everything all health. So today we just want to get to know her up close and personal behind and beyond the stethoscope. So, Doctor,
Yes,
welcome to the first episode of All Health Talks.
yes. It's the first one, and yeah, thank you.
Yeah, so from the scale of 1 to 10, how excited are you? I know I'm at 11.
Yeah, I'm at a 10.
Yeah.
I think still adjusting to life in front of the camera, but I'm excited. It's a great venture, I think,
Yeah.
because I mean this is where everyone is at the moment, and this is the best way to get to know someone, especially a professional or your doctor. You know, it's nice to see them. It's nice to hear what they have to say, not necessarily just in the consultation room.
Absolutely, absolutely. So the theme of today is new doctor on the block, new doctor in town. So maybe we should start up. Where have you been before you just give us a 2-second version of ourselves? Why new doctor in the city, new doctor in town, new doctor in the block? Where have you been?
So new doctor, essentially, it's new doctor, a new family doctor.
Yeah.
So I've spent the last decade in the emergency department in casualty. I think initially, after graduating, I sort of set myself on a path to become an emergency medicine practitioner or
Yeah.
specialist. I did that for a decade, and unfortunately, after a decade, I was tired. Casualty is very tiring. But I think I also just felt that I'd lost the heart for it. But I still loved, I think the big thing with me, because everybody was always asking, when are you going to specialize? And it was always difficult for me to answer that question because I love to see everything. I don't want to be, like just the neurosurgeon who deals with the brain or just the cardiologist dealing with the heart. I enjoy seeing different aspects or different types of cases and, different types of assessments. So casualty obviously gave me that because, in casualty the entire day, there's something different that walks in. So I sat with myself and I said, you know what, I'm tired in casualty, but I still want that. And obviously then the obvious next step was, become a general practitioner, go into family medicine, because that's a space where you're still similar to casualty, but obviously without that urgency and without the adrenaline rush, but still seeing something new every day with every patient.
Yeah, that's amazing. So, who is Dr. Renderani?
Okay, so yes, I am Dr. Lindelani Mutshekwane, born and bred in Johannesburg. But family is from Venda, Ramba Chivenda, Mutshekwane ndi Chivenda. My name is also Rinderani. It is similar to the Zulu name. It's the same name, same meaning, but yeah, we also use it in our culture. So yeah, as I said, born and bred in Joburg. Started off as a child, born and bred in Soweto, in Diepkloof. Then later on, the family moved to the north and settled within the northern suburbs. So yeah, went to school there, in and around, and then after matriculating, decided to then go and study medicine in Cape Town. So spent 6 amazing years at UCT. Came back because Cape Town is far away from home, and I was ready to be close to home and ready to serve the community.
Yeah. So with that being said, I mean, you could have been anything. You could have been an engineer. You could have been an attorney. You could have been an architecture. Why specifically medicine? Why did you decide? Maybe the question should be, what inspired you, to go for medicine?
So this is probably the second time in my life I am going to tell the story. I'm going
Yeah.
to give this explanation. I think I told it at my graduation party, and I guess I'll tell it again. I think during my graduation party, literally, tears were streaming, but it has settled a bit better now. So, what actually inspired me to become a doctor? So, fortunately, in our family, there's actually two Dr. Mutshekwanes, which is why people tend to call me Dr. Lindelani, just so that there isn't a confusion
Yeah.
between the two. So, it actually started off that way that we once both had a practice we were running together, and obviously, people would say Dr. Mutshekwane, and we'd both turn around. So, I decided I was comfortable with being
Yeah.
called Dr. Lindelani, and then she's Dr. Mutshekwane. So that's why people often call me Dr. Lindelani. So I mean, my cousin herself, I mean, she inspired me, and I'll say that she was actually the secondary inspiration when I really answered that question truthfully. What happened? We had a tragedy at home when I was young. So when we just moved into the suburbs, there was an incident where my father was killed at home, and unfortunately we were all there when that happened. So we were all there, and it was literally my mom and my sisters and all of us, and we were trying to help him, while we are waiting for the ambulance to come. They eventually arrived, but unfortunately, he demised. So one thing I always take from that day, and I remember when I was, in matric, or actually in grade 11, when it was like, what do you want to do? And it was sort of like you're taking a different turn. So my mom is an accountant. Both my older sisters are also accountants. And I did accounting. I was very good at it. And everybody just thought that, oh, okay, you're going to be an accountant like
Yeah.
everybody. But I remember when I was filling out those registration papers and ticking on what am I applying for, I knew the answer. And I was like, no, I'm going to be a doctor. And the reason why I say that is that I think all my life, I always wanted an explanation. I always wanted to know, why did he die? Yes, he was shot, but I needed more. I needed to know more about what actually happened to him. So that is actually the true reason why I decided to become a doctor. And after med school, or obviously after I'd learned about the human body and and pathology and all of that, I got that closure. So it gave me that closure that I got to fully understand that, okay, this is what happened. And yes, there was nothing we could do. Um, but I just had this thing that I never want to be in a situation where someone is in need health wise and I'm completely helpless. Because I think that was when we talk about it now with my sisters and my mom, the big thing is that we just felt so helpless because, you could see he was there and he was going and, we didn't know what was going on. So, strangely, as I say now, I know that there's nothing we could have done, but as I said, I never want to be helpless when somebody is in need in terms of health. So that's where that comes from.
Who knew that a flower could grow from the concrete? And that's an actually interesting story and an anchor of motivation to why you want to do what you do, like how you do what you do, and everything that you do, it's anchored in that story. So that's an actual good inspiration. From that tragedy, became Dr. Rinderani, the one that we know now.
Yes.
And from Dr. Rinderani, now we have AllHealth SA,
Yes.
which is now in Atteridgeville.
Yes.
So just from what you told me then to where we are now,
Yeah.
AllHealth SA. I mean, a lot of the many doctors would have went with it. I know that I'm McJuke. I would have said McJuke practice,
Yes.
McJuke and Associates.
Yeah.
So why specifically the name AllHealth SA, and why did you choose Atteridgeville?
Okay. So firstly, in terms of the practice, yes, most GPs actually, yes, the practices are in their names. So I think the first thing was I just thought, oh, that name is so long. I was like, Dr. Lindelani Mutshekwane Incorporated is just so long. And I just thought it was too much for me. And I just felt, oh, people are going to be like, oh, gosh, that's that long name. I wanted something that people could see, something that they would remember, something short. Because then obviously after that, you literally have to create, you have a website and it's literally www.Lindelani Mutshekwane,
Yeah.
So it was more, first of all, it was just too long. And then I think the other part, as I mentioned before, there are two doctors in the family. So
Yeah.
my cousin does have practices and businesses using the Mutshekwane name.
Yeah.
So the other reason is that I felt if I come out also with more of this, obviously we are separate individuals doing different things. So that was another reason that I need to find a way just so that what we're each doing doesn't get
Yeah.
confused. So that is why then I said, okay, let me find a name, and that's when I came up with AllHealth SA. The other reason why I chose AllHealth SA is that I think I have a broader vision. Obviously, at the moment, the first step is
Yeah.
a family practice, a GP practice, but there is a further vision in terms of what AllHealth SA will do in the future and other aspects of it. So that's also why it needed to be something that will, one day be able to accommodate other forms of business still within health, but something that an umbrella term or an umbrella name that can,
Yeah.
accept the things that I'm planning
Yeah.
in the future. In terms of Atteridgeville, so obviously when I decided that, okay, I want to open up a practice, obviously we did market research in and around Gauteng. My one big thing, because I mean, most people thought, okay, well, open up a practice, near where you live, and I also live in the northern suburbs. But I think already there is, once we did that market research, there's a huge saturation of doctors already within those spaces or within the space around where I live. And then I felt that, well, that's not really to the heart of what I want, because as I said, I want to be out there helping people, helping the community.
Yeah.
So then I said, no, let's spread out. Let's look more into, peri-urban areas, or as people call them, townships. And I think I like recently what a professor said, that we should stop calling them townships. They're towns,
Yeah. Yeah. Fact.
they're peri-urban areas, they're towns. So we looked around, looked in Soweto, also high saturation there. I'd worked in Fosterus before. So we sort of looked around as
Yeah.
to where we could find, and we drove around and saw different practices, different areas. So I think the practice in Atteridgeville, I think when I came across it, it's a really beautiful space, well set up, and I think it was a space that allowed me to start as soon as possible, and it was a space that was open to what I wanted to do. Atteridgeville also, strangely enough, has a lot of sentiment in my family. My grandfather was a dean, a pastor, and he actually used to run one of the Lutheran churches in
Yeah.
Atteridgeville.
Yeah.
So it was a place I was familiar with, because as a child, it's a place where we would go see family, attend church. So there was also that extra sentiment that when I drove into Atteridgeville, and I remember I was with my two sisters, and as we were driving in, we started remembering, all
Yeah.
those times we were here. So I think there was also just that little, maybe this is the place, this place knows a Mutshekwane, and, hopefully it will, welcome and accept another
Yeah.
Mutshekwane in a different way.
Yeah.
But in the sense, as much as he was a pastor helping people, I'm here as a family doctor, here to help people also.
Yeah. So you basically carrying your grandfather's legacy.
Yes.
Yeah. So, this initiative, All Health Talks, it should mean a lot to Atteridgeville. Not only Atteridgeville, but to South Africa, Africa, and the world abroad. But now let's zoom in Atteridgeville. What does this initiative, this podcast, All Health SA, what does it mean to somebody living in Atteridgeville, born, bred, peanut buttered in Atteridgeville, or they moved to Atteridgeville? What does it mean to the community of Atteridgeville?
So I think for me, what I want this podcast to do, because I think what I've realized over the many years is that, and every day when I see patients, people or the community in general, as much as they know, bits and pieces about their bodies, health in general, or the conditions that they may carry, people often have the incorrect knowledge. People are often not sure about, what it is that they have or what it is that they're taking. And I mean, they'll tell you at my practice, I do tend to spend a lot of time with patients because I'll have somebody that comes to me and they say, I've got high blood. And then I'll ask them, what does that mean to you? Do you know what that means? And they'll say, no, I was just told I have this. And then, I'll ask them, what tablets are you on? And they'll say, I don't know. They'll tell you, I'm on a pink one, I'm on a blue one. And then, you start to look at their compliance and things like that, and you find out it's not good. And you ask them why you're not compliant. And they say, well, I feel okay. So I figured if I feel okay, I don't need to take the tablets. So I think there are big main medical issues that as we go through with these talks that I want to speak about, because I just feel like as doctors in general, a lot of us do struggle to properly advise and counsel our patients and give them the knowledge that they need, and not just about their conditions. I'm a huge advocate for preventative care and wellness. So also, and how do you take care of yourself so that you don't reach that stage where you develop a comorbidity or a condition? So for me, the point of these talks is to educate the community. Obviously, as they get to know me, but as I said, just educate them about their health, educate them about staying healthy, and also educate them about any conditions or disorders that they have or that they're worried about, and what to do, and how we as doctors can help manage them to get them to a standard state of health.
Now, I once heard you talk about Ubuntu in healthcare, that you are not addressing the problem, you are addressing the person. And if you can heal the person, you spoke about Ubuntu, you also spoke about 3 levels of health, I think, which encompasses AllHealth SA, which is the mind, body, and soul. And then now we are pairing it with Ubuntu. So how does that anchor AllHealth SA in your own perspective? Because with that, like you said, you're a big fan of preventative care. Whenever you do something, you really put your heart to it. So with the mind, body, and soul, and pairing it with Ubuntu, how does it anchor AllHealth SA? And what should the residents from Atteridgeville expect from that when they're coming into your office?
So I think, as I said, when I was talking about Ubuntu, one big thing about the way that I work, or the way that I interact with my patients, is that I don't not every patient is the same. Not everyone is the same, and in that way, you can't have, as a doctor, you can't have a generic way that you approach every single patient. Because in a day, you're going to have an 80-year-old walk in, you're going to have a 16-year-old walk in, you're going to have parents coming in with a baby walking in. And there's no way you can approach all those 3 consultations in the same way. And also, so I think the first thing about Ubuntu is also, I always have this thing that, because sometimes people are intimidated or afraid of professionals, including doctors. They get people who come in and they're anxious, and because of previous experiences that they have. So usually the one thing that I always do at the beginning of a consultation is, we have just just an opener. What's your name? Where do you live? What do what's your language? What are you doing? So just so the person can be at ease. And one thing I generally do is, fortunately, I am multilingual, which is really great. And one of the big things is that when a patient is opening a file in my practice, I ask them to note, what language they speak. And the minute they walk into the room, I address them in their language, and I try to do as much of the consultation in their language, because a lot gets lost often when we're trying to speak languages that we're not used to, especially in health, because sometimes there are things that people can't explain in, well, I'd say English, which is essentially the universal language that we use. So I think that's part of the, as I said, the Ubuntu, is that you need to learn. And I mean, if you go to universities now, I mean, there's an English, there's a language portion to the process. I mean, in UCT, we had Xhosa lessons. I think up here in Gauteng at Wits and at Pretoria, they do Zulu. They do Sepedi, because you need to know the language of the people that you're dealing with, because oftentimes not everyone speaks English, or not everyone can explain what is wrong with them in English. And I mean, what I love, as you know, our latest census report just came out, and I mean about it's about 82 or 88% of our population is Africans.
Yeah.
So I feel if when that is the case, obviously, as we know as doctors, that's the majority that you're going to be dealing with.
Mm-hmm.
So it is, and Ubuntu obviously is a big thing between us Africans. So
True.
the one thing you need to know that as a doctor, especially working in a peri-urban area, is that you need to address people in a certain way, and especially the elderly.
Yeah.
And it's even better if you can speak to them or consult with them in their language and explain things to them in their language,
Yeah.
because I find that then people take it in a lot more and understand a lot more, other than reading something that got out of a textbook, and you're explaining in English and high level, or medical
Mm-hmm.
English, and somebody comes out of there and they just don't know. They just say, I've been to the doctor, I've got tablets,
Yeah.
I'm going to be okay. I want people to come out and know more, and so that they can even do more when they get home. Because I usually like to educate patients to say that, this is what's happening with you now. And I give you a little bit more education so that, listen, if in your family you see somebody going through the same thing, you can give them some of the advice I've given you, or
Mm-hmm.
obviously you can send them my way so that I can give them sort of the same type of
Mm-hmm.
education.
Wow, that's amazing. Now, empower her.
Yes.
We have an ongoing campaign. I think it's a beautiful campaign. It is not only we're not reducing it to like World Cervical Cancer Day or World Breast Cancer Month. It's something that you're really passionate about, women's health. So tell us a bit about the campaign Empower Her, and what impact does it have for women in South Africa and in Atteridgeville?
So yeah, as you said, I am a big advocate for women's health, and I pretty simply as a woman myself,
Yeah.
obviously growing up, I have gone through or go through a lot of the things that women go
Mm,
through, and I think what I found is that women, the one thing that I love about women do stand up for themselves. They stand up for their health.
mm-hmm. True.
If you often look at statistics in hospitals and in practices, they will tell you that the majority of patients are usually female
Yeah.
or a woman, because the one big thing about women, and I think the reason why we do that is that because most of us, we're mothers, we're sisters, we're
Mm,
daughters, and we at home we take on such a huge role that we know that we can't afford to be in ill health, which is why women tend to approach or go to the doctor a lot sooner than than men do.
yeah.
But what I've found is that obviously as women come in, because people often just come in for, I've got a flu, just the thing that's affecting them now. And as I was talking about wellness the other day, one thing I always ask is that, have you had your annual health check? And a lot of people will look and say, what is that?
Mm,
And with women, obviously the big thing, and the big causes of mortality and morbidity in women, and especially in terms of cancer, which is now becoming a big thing in our
yeah.
country. There's a rising incidence in terms of cancer. And when it comes to women, if you look at the top 5 list of actually cancers that are causing illness within South Africa, you've got breast cancer
Yeah.
that's sitting probably at the top of that list. And I think third on that list is cervical cancer.
Mm-hmm.
And those are 2 cancers that affect women.
Yeah.
And the statistics in terms of how many are affected and how many are ill are actually quite high. And it's sad because it's something that is treatable. It is something that is
Yeah.
actually even preventable if it is caught at an early stage. So for me, that's where, and I think part of also, as I say, there's always something in my life that will push me towards something.
Yeah.
So in that sense, unfortunately, a few years ago, we lost a family member, my
Mm,
aunt, to cervical cancer. And and strangely enough, as we were going through, what happened afterwards, it was just literally that thing of, when I was sitting there speaking to my sisters, and my cousins, the females,
mm,
and I literally once I sat down with them and I said, guys, when was the last time you guys went for a pap smear? And everyone said, most said, I've never had one done, or it was after I did it 5 years ago.
yeah.
And I realized, guys, this is a problem, because as we're sitting there, cervical cancer is, if you catch it at an early stage, if you do your yearly or 1 to 3 year pap smears, it's something that can be cured
Yeah.
and not have to end up causing death. And a lot of people don't know that. So that's where I got into, especially. So I think at that time I actually started doing talks about cervical cancer, talks about pap smears, because I know women are they think that it's a very uncomfortable, painful,
Yeah.
arduous procedure, and it really isn't. And it's life saving. It is literally life saving. If I do a pap smear on you and we pick up a problem and it's at an early stage, we can literally do things and and save your life.
Wow.
And equally the same thing with breast cancer, just teaching women about that yes, the breasts are there, but actually need to examine them, you need to take stock of them. If you find something strange going on with them, go to the doctor, have them checked out.
Yeah.
And I mean, as part of wellness programs that are actually there, and it's actually a benefit that most people don't know. Most people don't know that as part of your benefit, outside of what we call your savings, there's actually a wellness benefit that comes with majority of medical aids. And part of that benefit is that every year you get a pap smear. Every year you can go for a breast exam or a mammogram after a certain age. It's part of the package, and a lot of people, obviously I'm in private, I'm dealing with a lot of people in medical aid, they don't know that.
Yeah.
So that's essentially where the Empower Her campaign comes in. And it's not just about, because obviously you find that it's mostly women in their 30s or 40s. The Empower Her campaign, for me, it starts from a young age. So even with my young patients, with my teenagers, or with a mother who's coming in with a 9-year-old, because especially now with cervical cancer, there is a vaccine
Yeah.
that has come out that we can give to young girls to prevent them actually getting HPV, which is a big a big a big virus that tends to lead to cervical cancer. So even from that young age, I'm always talking to moms who comes with little girls, and I say, has she been vaccinated for HPV? And a lot of them are saying, what's that? And obviously then you start to have that conversation. So that's another big part of
Yeah.
Empower Her, is that from the young ones, to abokoko, there's a lot to talk about.
Yeah.
There's a lot to do. There's a lot that we can collaborate and help with each other with, to make sure that we stay healthy.
Yeah.
Because as I say, even now from the census report, when we look at our current sort of the mortality, or our current our life expectancy. Our life expectancy is still sitting in sort of the 60 to 65 range, which is actually, it's a slight improvement, but it's not that great.
Yeah. True. True.
If you look at most 60-year-olds right now, they actually, there are a lot of healthy,
Yeah.
active 60-year-olds, but unfortunately a lot of people are succumbing to death at that age, and it's because of all these things that we will talk about
Yeah.
during our AllHealth SA talks. And as I say, a lot of the stuff is preventative. It's, if you take care of yourself, you can prevent so many things from occurring, and we can get to a stage where we can be like first world countries, where they've
Yeah.
got life expectancies sitting in the 70s, 80s, and 90s.
Yeah.
So it's obviously trying to bridge that gap, get people more educated, and just helping people to live better and
Yeah.
to live longer.
True, true. So basically, what we are doing with the campaign is we are empowering women with the knowledge that is going to not only save their lives, but with the knowledge that is going to also help them to thrive.
Yes,
You know, because the Bible says that where there's lack of knowledge, the people perish. So
exactly.
people don't have to be miseducated about this thing. There's a campaign, ladies. There's a campaign.
Yes,
There's a lot of education. So follow us on our social media. Read blogs on our websites. Engage with this, podcasts. Just engage with Dr. Rindaran. Now, let's talk about the community involvement.
yes.
How do you plan to engage the community? Is it through school talks, church talks? Do you go to offices, conduct talks? How do you basically, how does All Health SA intend, or how are we are we actively involved in engaging the community? Because it's important for us to meet them where they are.
Yes.
Yeah.
No, definitely so. So part of our community involvement, not just with me, but I think with the medical center and my colleagues there, because it's something that, I mean, I already myself knew that, if you want people to know you, you have to go out to where they
Yeah,
are.
true.
And obviously, usually, and actually in all communities, you have to find where people gather, So in terms of community, going into the community, we do have a plan. Definitely going to, the churches, and especially and not just the big churches,
Yeah.
you know, all, if, I mean, if we have the ability or the capability, all churches, but we will definitely be going into the churches to do wellness days there. So already at the medical center, there is actually a campaign. Every 3 months, they do wellness days in churches. So definitely, I'll be joining that, and we'll continue that, and possibly maybe even get to a point where every month we can go out.
That would be
Because,
amazing.
as you said, it would actually be very nice to get to a point where we've been through all of these places where people gather. Another place is just that at the moment, and it's something we wanted to do now, but we realized that, it's exam time,
Yeah.
is going out to the schools. Out at the schools, you actually end up targeting two population groups, because at the schools you're able to reach out to the teachers,
Yeah.
and you're also able to reach out to the children. And I think that's the schools are very important, because obviously the children, we teach them a little bit more about their health,
Yeah.
because I feel like that's also an area that is neglected a lot.
True, true, true.
And they get to go home and tell mom and dad and tell their families that, hey, we were told this today. I learned something new today. And as I said, then we also target the teachers. Other areas of communities, or where people gather, we've looked at the shopping centers and the malls. And fortunately enough, about 2 months ago, we were actually involved in a big campaign that the local radio station did, Peli FM, at one of the shopping centers, and there was a lot of us there, including USAID, the people from the local hospitals,
Yeah.
Galafong and Steve Biko. It was actually an amazing campaign that we did, where people got to come in and get free health checks, going from HIV to checking blood pressures and checking for diabetes. It was actually quite an amazing thing that they did, that we joined, and we actually came back and we said we also need to be able to actually just on our own go out and do that ourselves. It really doesn't take much to go in on a Saturday, especially month end. Everyone is at the mall, everyone is at the
Yeah.
shopping center. You can go there, you can set up, and you can you give your time on that day to speaking to people, and doing some wellness checks on them.
Yeah.
So definitely we've already started, and there is a plan to try and reach every corner of, and not just Atteridgeville. So I think one thing I've noted is that it's not just
Yeah.
people in Atteridgeville that come to the practice. It's Atteridgeville and the surrounding areas. So we do see we've got a lot of people coming in from Soulsville, people coming in from Lotus Gardens and other areas of Pretoria. So I think one thing is, where it's not just Atteridgeville. I mean,
Yeah.
anyone in and around the area can come, can find us, can come to our wellness days. I mean, we will definitely advertise and make sure that people know when we are going out to a church, we're going out to a school, we're going out to a shopping center, to go and educate and to do wellness checks.
Yeah.
So definitely in the plans, and definitely something that must be ongoing, in the future.
Yeah. I'm personally excited about these plans. I don't know about you.
Yes.
So let's talk about the services.
Yes.
Just before we close, let's talk about the services. I know there's general and emergency practice. I know there's women's health, there's men's health, there's corporate health,
Yes.
there's antenatal, there's all health SA.
Yes.
But then I want I want you to tell us, about some of the services that we can expect when we go to all health SA.
All right. So, obviously at the core of it, I'm a general practitioner, and general practitioner, as the name says, essentially, we cover everything.
Yeah.
and we cover all ages. So, some often a lot of my colleagues call themselves family doctors.
Yeah.
So I'm a doctor or a practitioner that can handle diseases and disorders, from birth up until old age. So I'm a doctor for the babies, for the children, for the teenagers, for the middle aged, for the old age. And dealing with all types of disorders. So GPs or family doctors, we are actually along with primary health clinics and nurses, we are the first door. We are the first step
Yeah, true.
in terms of health. We are meant to be the gatekeepers. So in that sense, that we are either able to pick up on anything or everything, and hopefully manage most of the stuff. And whatever it is that we can't manage, then we escalate to our colleagues, the specialists. So, in general, essentially, I'm a doctor that can deal with, can manage, and can assess most of what ills or ails people. So, part of that, as you said, I'm a general practitioner. As you've mentioned, I do have a special interest in women's health. So definitely that doctor that pushes and is constantly educating my patients about coming in and having their pap smears done, doing breast examinations, sending them for mammograms. I do also manage what I'll say minor um, injuries and conditions. So yes, so those are things like if somebody has cut themselves, being able to suture wounds. If somebody's got an abscess in an area that I can deal with, it's dealing with that. If somebody has sprained their ankle, that is something that I can deal with. So as a GP, we don't work. I don't work as a silo. I do have specialists that I do often speak to about cases. I am a doctor. I do blood, so I can take bloods and send off blood tests, and we do that as part of annual checkups. I can send you off for an X-ray. So essentially, we are the ones that
Yeah.
we can do anything. We can assess everything, and whatever it is that we can't manage, we definitely come up with a plan to then escalate it to specialists or other levels of care. But we never leave you. We are always at the heart. We are always at the heart of your of the management of whatever it is that ails you. So even if I do send you to a specialist, you still come back to. I'm still your doctor. You still come back to me. But as I say, it if you get to a point where people actually, when they start getting sick, and as they start getting sick, they go and see their doctors immediately. There's a lot of stuff that we can deal with if you come early enough. The biggest problem that we have, and especially within the public sector, is that people often go to the clinic or they go to the hospital late.
Yeah, true.
They go there when they've been sitting for 6 months or a year with this issue, and by the time they get there, it's at a late or at a stage where it is very difficult to deal with. So that's also the one big thing I constantly speak to about my patients, and especially my male patients, is that if you're feeling unwell, as soon as you can, go to the doctor, go to the hospital. Don't wait for things to get worse. Because I think it's one thing that gives doctors or hospitals a bad reputation.
Yeah.
People will say, "Oh no, at that hospital, everyone always dies there." And if you go and ask the doctors and sisters that work in that hospital, they'll tell you that it's not that everyone dies here. It's just that people come here when they are dying, and that's what has brought up that stigma about hospitals, and especially public hospitals, is that when you're unwell, get help. There is help available for those in public and for those in private. Stand up for yourself, stand up for your health, stand up for your life.
Yeah. Wow, that's amazing. Um, let's talk about the everything overall. Like what should our audience, our patients expect with this initiative? Are we gonna be having guests? Are we going to be inviting some other people? Are we also going to be inviting patients to talk about their stories and their journey? So what should people expect with the overall vision?
I think definitely, as you have mentioned. So, I mean, with the talks, as I said, we'll be targeting, and I'll say the main or the general conditions that are affecting people at the moment. As I said before in my previous podcast when I was talking about biopsychosocial.
Yeah.
So obviously, at the moment, one of the big things is mental health. So definitely we will have a mental health talk. And obviously, in terms of mental health, as much as we are able to diagnose and manage it, obviously the biggest stakeholders in terms of managing mental health is your psychologists and your psychiatrists and your social workers. So we'll definitely be having a talk, a mental health talk, with one or two of those specialists here, just to give us more clarity, or in terms of mental health, because it's a big problem at the moment. And yeah, as you said, patients, or anyone that is willing to come in, and we either discuss something that they are going through, or we just we give out more information about things that they are interested in. But essentially, going forward, the next couple of talks will be targeting the main disorders and diseases that are affecting our community. And yes, definitely bringing in specialists, bringing in previous patients that have gone through those things, and just giving people more education about about their health, and about the things that matter at the moment
Yeah.
right now in our country.
Yeah, yeah, and a lot of things matter, and like you said, there's a lot of education that needs to go into a South African citizen. There's so much that we need to know, so much information that we can gather that can help us to prevent a lot of things. And with that being said, we have gotten to the final leg of our conversation.
Yes.
It was nice having you.
Thank you. Thank you.
So next time, guys, it won't be me sitting on this chair. It'll
It'll
actually
be
be
me.
somebody else.
Yes.
And then the doctor will carry the whole thing on her shoulders. So, do you have any final remarks?
I think probably just what I said now is that, guys, take care of yourselves, take care of your families. Like with anything in life, don't procrastinate, especially when it comes to your health. And as I just said, stand up for yourself, stand up for your health, because you matter. You matter to yourself, you matter to your family, you matter to the community. And obviously, if you are not well, then you cannot serve your purpose. My one big thing is, as a God fearing woman, is, we were brought on this earth to serve a purpose, and give yourself the chance, or give yourself the ability and the strength to serve that purpose. And one big part of that is taking care of your health. So yeah.
You heard it, ladies and gentlemen. One big thing is taking care of your health. So, how are you going to access this conversation? You ask. You are going to access it through our website. It will be available on our website. It will be available on our YouTube channel. It will be available on major podcast distributions like Google Podcasts, Apple Podcasts, Spotify Podcasts. So it'll be basically available for you. The keyword that you need to search is All Health SA, and all that information will be shown on the screen. We are active on social media. We have an Instagram account, we have a Facebook account, we have a TikTok account, and these accounts have value in terms of health education. So thank you guys for joining us. And if you want to get to know the doctor, or if you want to get to know more about All Health SA, go to www.allhealthsa.co.za. If you want to speak with us personally, send us an email, go connect.allhealthsa.co.za. And with that, Doc, high five.
High five. Yes,
Thank
we
you
can
so
high five again.
much.
Thank you. Thank you. Thank you.